All right, this is a mishmash of slides for Lab Exam 2. These first set, these are the artery and vein slides. We did arteries and veins last time, but I held off on the slides. So what you got is right here, this thing is an artery. Kind of notice it keeps its shape because of that stiffer wall. Over here, this misshapen mess here, that is a vein. So let me change my pointer out a little bit. All right, so you just recognize this as an artery here. And this other one over here is a vein. On the artery, I'll usually look at the layers. So let me click to the next slide and we'll look at the tunica intima, which is that dark line there, tunica media and tunica externa of the artery. All right, this is just a higher magnification of the artery. And this little dark line you see running right along the inside, right in contact with the blood, that's basically all you can see of the tunica intima. Very thin. Remember, it's just an endothelial layer and a basement membrane. Then this thick layer from here all the way out to here, that's tunica media. You see a lot of muscle here, and then out here, these are the elastic fibers. They typically will stain black. This is a small, medium-sized artery. Out here, this is the tunica externa. It's also sometimes called adventitia, but tunica externa will work. So those are the layers of the artery. So just identify it as an artery, identify the layers for me, you'll be good to go. All right, this is a slightly higher magnification image of the lung. And what you see, all of this kind of white open area here, that's one alveolus. And the walls here are basically made of simple squamous epithelia. That's why it's so thin. Of course, there's blood vessels running through it as well, which are hard to identify. But that's it. It's the lung. You got alveoli, you got simple squamous epithelia. That's about all you can do with it. All right, this one. This is a lower magnification image of the same thing, of a lung. And you can see the alveoli out here. All these little, looks like Swiss cheese out here. It's mostly open space. That's where the air would be. You got the simple squamous epithelia forming the alveoli. What you can see on this one, this thing down here, I'll kind of circle part of it. This is an airway. This is the lumen right here. That's where the air would be. You can tell it's not a blood vessel because if you zoom in on this epithelia, it's cuboidal or columnar, not squamous. And the dead giveaway, you got these cartilage plates in here, which would not be found in a blood vessel or anything else. It's going to have to be an airway. So this is a bronchiole or a small bronchus. You can't really tell which, with the hyaline cartilage plates in it. And then you see alveoli. It's about all you can do with this one. All right, this is a cross section through the trachea. Up here, right up here, this is the airways, the lumen of the airway. So lining it right along here, that is that ciliated pseudostratified columnar epithelia. Then you'll see this big massive thing right here, and the other side of it's over here. That is one of the hyaline cartilage rings. So you'll just recognize this as the trachea and those parts, and you'll be good to go. All right, this one. This is a cross-section through the esophagus, so of course part of the digestive system. And a couple things to note. Again, the lumen is up here. And then you'll notice the wall, you can see 4 out of the 4 layers. Right here, this dark stained layer, that is a mucosa. So when you look at the entire alimentary canal, from esophagus down to anus, the tube is made of 4 layers. The one on the inside closest to the lumen is the mucosa. Then you'll have a submucosa, then a muscularis externa, then a serosa or adventitia outside. This part right here, darkly stained, that's the mucosa. In the esophagus, it's stratified squamous because there's a lot of abrasion. Then this lighter area right here, with that little artifact in it, that's a submucosa. It's got a lot of loose connective tissue in it. There may be a bunch of glands in it, depending on what part of the alimentary canal you're in. And then this layer is a muscularis externa. It's a couple layers of smooth muscle. There's a longitudinal and a circular layer. You can't resolve them here on this. And then there could be an outer layer here, serosa or adventitia, depending on where you are. It kind of holds it in place. So this is the esophagus. This is another part of the alimentary canal. This is the small intestine, and you can see the mucosa right there. It's darker stained. And in the small intestine, you'll see the mucosas thrown into these little finger-like projections. Those are the villi we talked about in lab. You can see them on the cat's intestine, but they're just tiny, tiny things. Much easier to see them here. You got a submucosa here, that's loose connective tissue with a lot of glands in it in the small intestine. And then out here, you can see the two layers of smooth muscle, the circular layer and the longitudinal layer. You can't see the external layer too well, the adventitia. But that's the small intestine with the layers and the villi. All right, this is a high magnification image of the kidney tubules. I typically won't use this much on the exams, but you'll see a section here. This is one of the kidney tubules. Most of these are proximal and distal convoluted tubules. Looks like a blood vessel over here, but I don't usually use these higher magnification images. You can take a look at it, but I probably won't ask on this one. This is another high power magnification or high magnification image of the liver. You can see a lot of the sinusoids, blood as it passes through. These sinusoids are very, very permeable capillaries. After the blood moves through the hepatic portal vein, it goes into these sinusoid capillaries in the liver where the hepatocytes, the liver cells, process it, detoxify it, store carbohydrates, that sort of thing. There is another slide I'll be more likely to use on the liver that shows all the bile ducts and blood vessels running in a set of 3 in a triad. All right, this is the liver slide I'm likely to use. You got the blood sinusoids here and hepatocytes out here, but this area right here, this has sections of the hepatic portal vein. Right here is hepatic portal vein, big branch of the hepatic portal vein. Then you will see some bile ducts, and they'll have not squamous cells around them. They're usually cuboidal, and often these cells are pigmented. They're stained a bit. And you should be able to see some branches of the hepatic artery. That'll be on the next slide. This one, it's a little higher magnification, a little better view. Here's the hepatic portal vein over here. You can see the red blood cells in it. This is one of the bile ducts. You can see the pigmented cells here. They're not squamous. And this right here is a little branch of the hepatic artery. Of course, goes into the liver to supply it its oxygen needs and such. For now, this is the main slide that you'll see in the kidney. This is of the kidney's cortex. That's the outer layer in the kidney. And what you'll notice is this kind of oval-shaped mass right here. This is a specialized capillary bed. It's called the glomerulus. And as I mentioned, the kidney gets like 30% of the cardiac output. Much of it runs through these glomerular capillaries. And this is where the process of urine formation begins. You'll notice this white space just on the outside of the glomerulus. That is the Bowman's capsule, which is the beginning of the nephron. This is where material will move from the blood into the nephron for processing. Collectively, the glomerulus and the Bowman's capsule is sometimes called the renal corpuscle. The rest of these little circular things out here are proximal and distal convoluted tubule. That's probably a distal there. It's a little more sharply defined. The proximal convoluted tubules have microvilli. They look a little rougher on the inside. Now with the slides, we're not going to distinguish between different salivary glands, but this is one of the salivary glands, and it's just a pretty slide. Here's one of the ducts from the salivary gland. You can see these columnar cells lining the lumen here. This is where the saliva would go to the oral cavity. See the serous components over here, but you can see these ducts stand out pretty well. They're pretty easy to see. All right, another slide in the alimentary canal. Sorry, these are not in any particular order. This is actually a slide of the stomach. And remember, the stomach is thrown into those rugae. So what you're seeing here, this starts up here, and the other side's kind of over here somewhere. This is like one rugae you're looking at. This area in the middle, this sort of bit right here, that is submucosa here. You're not seeing any of the muscularis layer. So this whole bit out here, this part over here, that's all mucosa. And these are not villi. These little projections, they look a little bit like villi. They're not. They're a little pointier looking. The gaps in between them, these are the gastric pits. They're the openings to the gastric glands. That's what secretes the pepsinogen, hydrochloric acid, the mucus, all comes out those gastric glands. So this is a section of part of the stomach. This is just a higher magnification of the same slide. You're seeing the gastric gland right in here is its lumen, and the pit comes out here. This is the lumen of the stomach out here somewhere, kind of where I am. Just higher magnification. I don't distinguish between the different types of cells, so you'll have a few high magnification slides of the stomach, looking at the cells that secrete different things, like the mucus and the pepsinogen. They're a little too hard to distinguish, so I typically won't use them. They're on here in case somebody wanted to. Again, this is just a high magnification slide of the stomach. I typically don't use it because it's too hard with most of our slides anymore to get the necessary characteristic to distinguish the different populations of cells, but that's part of a gastric gland there. Again, similar high magnification slide of a gastric gland. I typically won't use this. These are the mucus cells secreting the mucus that coats the stomach. Don't worry too much about them. They're on here. They're kind of interesting, but I typically won't use them. Oh, and this lovely is the toughest one of the batch. Not really. This one's a piece of cake. This is a cross section through a tooth. All they do is they cut it, glue it to a slide, and they grind it really thin. I think they use a little India ink on it. All you can see up here, let me get my pointer working. This is where the pulp would be. That's the pulp cavity. This long striated bit, that's the dentin, which is similar to bone structurally. And then you have this amorphous material on the outside, which is probably the enamel, which is like 95% inorganic, mostly calcium salts. But that is the tooth.